So it's my pleasure to introduce our next speaker. Erin Blatchley from the United States is a United States Air Force veteran, is the nurse manager of the Case Management and Telehealth Department of the VA Connecticut Healthcare System. That is a mouthful.
It is terrible.
Wow. I needed another cup of coffee before I said that. She's also credited for credited for developing the Operation Enduring Freedom, Operation Iraqi Freedom, and Operation New Dawn program with the federal VA system at Newington VA and West Haven VA. This program now has a much easier to say name called Transition and Care Management Program. It probably takes up less lines on a business card too, I suggest. And she's been instrumental in providing services and care for many of our warriors. It's a very important segment, particularly for those who are veterans or those who work with veterans who don't quite understand how the VA works. It's a big organisation with many moving parts, and Erin is not only a wonderful representative of the VA, but is very much a veteran advocate. So, Erin, welcome.
Thank you. Can you hear me?
Yeah.
Oh, good. I talk loud. I said I probably didn't even need the speaker.
Got your little clicker there?
Yep.
Go
thank
for
you.
it.
So it's a pleasure to be here and an honor to be asked to speak. So many things have already resonated with me as I sat in the chair listening this morning. No wrong door is really what this is about. It doesn't matter who you go to. You got to go to somebody who's going to get you to the right person. And if you go to one person and that's not it, just keep going. Because there is no wrong door to get anything you need. It's just finding the right person to help you get there. I'd like to do a little VA 101. The VA is a big umbrella, and we have the Veterans Healthcare side on one side and the Veterans Benefits side on the other side. When we first started doing this program, if you think of us as medical and my VBA friends as the money people, you got it right, okay? And the National Cemeteries is the third part. VA Connecticut is a big system. We have multiple facilities throughout the state. We have two main hospitals. One is a 24-hour, 7-day-a-week with a medical ER and a psychiatric ER. One is our Newington, which is a big outpatient campus, also where our VBA administration is housed. Okay. We have an Herrera Community Care Center, which houses a lot of our homeless, substance abuse, peer-to-peer, some of our mental health programs, and a lot of community supports. And we have 6 community clinics located throughout the state, which provide mental health as well as physical care to our veterans. Vet centers. We have multiple vet centers in our state, and they are underneath the VHA umbrella. And although their records are very different than ours, they can see our records, we cannot see theirs, but they are an integral part of our team. And I know for all the years I did this program, if I didn't have my vet center people to call, I would have been in trouble. Because they were really the people who could help connect. Most of the providers there are veterans, and a good number of them are combat veterans. And if I couldn't get through to a veteran, I'd call them and they'd say, hey, I'm a combat veteran, heard you've been to combat, want to meet for a cup of coffee. So we really were trying to engage them and bring them in. They provide non-medical, so it's mental health, but they don't provide any medications to combat veterans in active duty. And there's a few other people, as you can see, that qualify for care. We have 4 locations. Hartford, which is actually in Rocky Hill now, New Haven, which is actually in Orange now, our Norwich, and our Danbury. And they are just wonderful places with wonderful, welcoming people. And I don't know if anybody's here on the tables from the vet centers. Is anybody here?
Nancy into that earlier.
Who was?
From Danbury.
From Danbury? Yeah. So there might be somebody here, but it's an integral part and a thing we really use all the time. Okay, a veteran. Who is a veteran? Okay, so anybody who wore the uniform to me is a veteran. Okay, but when we start looking at different programs, every program has a different criteria of who is a veteran. So for the VA, anybody who served on active duty, okay, becomes a veteran. Anybody who served 24 consecutive months after 1980, and any National Guard or reservist who were called to federal status, completed their tour of duty in a combat zone place, become veterans eligible for VA care. And just so you're aware, combat zone for us is any place that they get imminent danger pay. Okay, so that includes a lot of places. I think Guantanamo Bay actually gets imminent danger pay, so they are considered veterans when they come home. Okay, so once you're eligible for the VA, you're eligible for the VA for life. Okay, and that's why it's so important for our young men and women, as well as anybody getting off of active duty, apply for VA benefits. Because if you don't apply, you may never be eligible again. Okay? So when the people go to deploy, our Guard and Reserve, when they come back, they have 5 years to register. Okay? That's their combat vet time frame. Okay? If they don't register within that 5 years, and then they go to register, it'll be based on their income. Okay? That was a regulation that was passed back in 2003, and it really did make a lot of veterans ineligible for VA care. Okay? Anybody who was in the system was grandfathered in, but people couldn't get into the system. So for our Guard and Reserve in our state, we go and actually register them. Okay, when they come back, we register them. For people getting off of active duty, we don't even know who they are. Okay, there's no mechanism unless they were referred to us from the DOD to initiate care. We have no knowledge of them. Okay, that's why I need everybody here to pass the word. Did you register for the VA? Okay, my husband's a 28-year veteran, not eligible for VA. Never registered when he got off of active duty. Okay, so those who don't register when they're eligible, there are some get-in free cards. Okay, so anybody who's service connected, and service connection is anybody who's compensated for an illness or an injury incurred during the time of service. Anybody who has a Purple Heart or is a POW. Anybody discharged with a disability that they incurred it during service. Anybody, as I said, combat after 11/11/98 enrolled with within 5 years. Okay. Anybody exposed to Agent Orange. So if you're a Vietnam veteran, boots on the ground, and I know people have gone to VAs and VAs have said you're not eligible. I actually registered a guy here in Connecticut because the Florida VA told him he wasn't eligible. But he was boots on the ground, he's eligible. Anybody exposed to Gulf War contaminants during the Gulf War in 90 and 91. And the latest addition to this is anybody exposed to the Camp Lejeune water during those dates. Okay. Those are the people who, it doesn't matter when they register, they'll always be eligible. And once you're enrolled in the system, you're enrolled for life. But if you're over the income guidelines and you're not service connected or have a special eligibility, you may pay a copay, which is kind of the same as your insurance. $15 for primary care, $50 for specialty.
Just a quick question on the Agent Orange, meaning that it's been documented that Agent Orange was at the base that you were assigned. Does that make you eligible?
What did he say?
You were on the Agent Orange one. Does that mean that if you were exposed to Agent Orange, meaning Agent Orange was on the base where you were employed?
No, you had to be boots on the ground in country.
Right, so if you were in country,
If you were in country even one day and you
Yeah.
have proof that you were in country one day, you are eligible for VA care.
okay, thanks.
Okay? Okay, so what does the VA provide? The VA has to provide anything that veteran needs for care. Okay? So that's a big arena. Okay? We provide emergent care, medical and psychiatric. We don't do trauma at West Haven VA. Okay? If you come in and you have had a traumatic accident or a fall, we'll probably transfer you right to Yale. Okay? We provide primary care, and our primary care is our team of people who manage your care. They're important to connect with them. They're important to stay connected to them. Even if you're seeing outside providers, I say to people, come in once a year because you need to stay connected. For the younger people, it means you may not have another insurance, and I'll talk about some of the coverage you get in the community if you stay connected. For the older folks, it means you may get sick and you may need something that your insurance isn't going to cover, and the VA may cover for you. Okay. Specialty clinics, we have ortho, we have derm, we have surgical, we have neuro. You need it, we have it. If we don't have it, we pay for it in the community and provide it. Okay. Polytrauma, that's our TBI clinic. And we do have an interdisciplinary team, like a previous speaker talked about. Has a psychiatrist that has access to a neurologist. We have physiatrists. We have all the therapies, vision, all those things to assess. And we do a simple TBI screening for everybody who comes in who's been deployed. It's a simple 4-question screen. Have you had these symptoms? And what a lot of people suck it up, and you're right, they suck it up and say, no, they don't have that. But inevitably they come back. Or somebody says you can't do this and you were used to be able to do this, they come back. And what we do is we just screen them positive so they can get to the next level screen by our physiatrist and our team. So we can really help these people. Because I had one kid who came back and his mother said to me, you know, he always managed the checkbook and he can't do that anymore. And I thought, one little thing, but how big is that? He manages money. So we do have this polytrauma clinic. It's an interdisciplinary team. They meet weekly. It's a great team. We have a pain center, pain clinic. We have lots of mental health throughout all of our sites. We have vision, and our TBI patients end up getting sent out for vision therapy, which we don't do within our facility, but we do pay for it in the community. And dental. Dental is, there's not a lot of veterans who qualify for dental. If you're 100% service connected and permanent total, you get dental. If your service connection is for something around your mouth, you get dental. If you're homeless, you may get some dental. If you're in voc rehab, you may get some dental. And the other people who get dental are our young men and women coming back. After a deployment, they get a one-time dental episode where we will examine them and fix anything that may be wrong. Women's health. So the VA has traditionally taken care of middle-aged men. And now we have this onslaught of lots of females. So it's become a new world. We have a women's health program. And we have a beautiful women's clinic in our West Haven campus, okay? Women who were in the military were the minority, and especially if you experience some kind of assaults, you do not want to go sit in a room full of all these men where you don't really feel safe. So this women's clinic provides women's care. They provide primary care, mental health care, GYN care, all in the women's clinic. That does not mean our women need to come to that clinic. They can get care anywhere throughout our system. We have competency validated providers throughout our system so they will all get the care wherever they choose to get it. We're obviously not delivering babies at the VA, but we're paying to deliver those babies in the community. We do lots of screenings, mammograms we pay for in the community. All of those things are provided to our veterans. Okay. Our transition and care management team, which is the original OEF-OIF program, their mandate started as just our combat veterans, and it really got our program involved with the Guard and the Reserve. We attend all the Yellow Ribbon events, and we really have become an integrated part of the state's team. I know many of the OASIS centers. I've been to probably a good number of them doing outreach over the years, but they really have become an integrated part of the team. They have expanded the program to not only combat veterans, but to any veteran leaving the military coming into the VA system. They are required to screen every single one of them for a variety of issues. We ask them about their military service, we ask them about their families, we ask them about jobs, we ask them about benefits. We kind of try to screen them and figure out who they are and what they need and help direct them to get there. We make sure, even if they're not a honorably discharged veteran, sometimes they're still eligible for some mental health care. And you'll hear from Jay later, but that's one of the things we do. We run around and figure out how do we get people care that don't always meet the guidelines. Because we're still invested in taking care of the veterans, whether we're bringing them to RVA or sending them someplace else. And this team has become a specialty case management team that is very important. They are the experts for post-deployment care. So when people have questions about how does this work, and I can't tell you how many times we get calls from whoever, family, employers, congressional people, can you tell me how this works? They become the experts to explain to people exactly how this goes and help get them to those places and resources. So when we start looking at our combat veterans, we have to look at some of these environmental exposures. If you Google any of these things, you can find all these things to sign up for on websites. Google has become the best, and I work at the VA, and I'll tell you where I find my information, Google. Because it's clear, it's simple, it's right there, and it helps, get the information out. But this is what the newest generation has been exposed to. And so we're seeing things, when you start talking about sand and smoke and exhaust, we're seeing things like abnormal pulmonary function tests. They're not really abnormal, but you have to remember these young men and women were so healthy and so fit that they were up here and now they're down here. They may still be in a normal range, but they've lost function. And we start to see a lot of different things happen, like we've seen abnormal pap smears in females. We've seen high cholesterol, which we think is due to the mental health issues and the release of cortisol. We start to see all these things that we've tried to track. And that's why I say to people, if nothing else, you need to have them documented in your record, and you need to file a claim for it, because that's how we gathered our stats for Vietnam. We're not going to know, if nobody files a claim and they say, oh, it's not due to my service, we'll never be able to gather the stats. I mean, look, it's taken us 40 years to figure out Vietnam. How many years is it going to take us to figure out the next one? Caregiver support program. So we've always supported caregivers, and it's always been a big part of our VA inclusiveness. But back many years ago, Michelle Obama decided to put in this program because what was happening is everybody got hurt at, in combat, and they were going to the Walter Reeds of the world, and they needed care. Their families quit their jobs, lost their homes, and moved to take care of their loved ones. And so she put into place this caregiver support program for the newest generation, and you can see for post 9/11 only, to give them a stipend to care for our veterans. And the reality is, it's a whole lot cheaper than the VA providing the care. So, I had one veteran, and he was going to school. He was working in the Oasis Center at the school. He was doing the radio station at the school. He was telling me all this stuff, and I thought, wow, he's really doing well. Until I talked to his wife, who was a nurse. And she said to me, so I need to tell you a few things. I said, okay. She said, first of all, he does not take a shower or change his clothes unless I instruct him and facilitate. Oh. She said, I sent him to school because I can't have him idle at home every day. And he gets engaged, and he did actually graduate, but it was kind of her way of saying, you can't sit here, you've got to do something. And so she is a paid caregiver now because it is a full-time job to do what she does, to arrange his schedule, to make sure he gets where he needs to go, to keep track of his appointments, to do all that for him. Okay. So in general, caregivers, they have a caregiver support group. We have a program coordinator and a whole team of people, nurses and social workers, who support our caregivers and help them access resources and services at the VA and everywhere else. Veterans Choice Program. So back a couple of years ago, our congressional people decided we were going to have a program called Choice. And what this Choice program said is if we can't see you within 30 days, or if you live 40 miles away from a VA facility, we were going to pay for you to go to the community. So we thought, okay, that makes a lot of sense. But they put together this program, and Health Net was the intermediary, which was TRICARE at the time. They managed TRICARE. We at the VA did not have any control of what went to Health Net. So you came in for an appointment, they said it's over 30 days, you want to go to the community, they said yes, they put you on this list went to Health Net, and us at the VA could not really see anything. Okay, so we had a period of time where that went on, and care wasn't being facilitated quick enough. The community does not know what we do at the VA. So if a veteran doesn't show up, we call them. If they don't show up again, we call them. If you're the community, you're done. You may be sending them bills because they didn't show up for 2 appointments, right? A no-show fee. We at the VA, of course, don't do that. We continue to look for them. We continue to try to cajole them in. We try to arrange the appointments. We try to do whatever we can do to get them in. So here they are out in the community, and it didn't really go all that well. Okay? So as of last September, Health Net was no longer doing any care for us. But the Choice program has stayed in place. Well, what's being happened now is we're going to the Mission Act. Okay, the Mission Act starts next month, no, June 6th. And what the Mission Act says is that 40 miles still exist, which really doesn't affect anybody in the state of Connecticut. But now they're going to change it. If you live over 30 minutes away from a primary provider or a mental health provider, or over 20 days, you can go to the community. And for specialty clinics, if it's over 28 days in an hour, you can go to the community. So people will want to go to the community. What people don't understand, and hopefully we're going to do a whole campaign to educate them, is it may take 30 days to get you into our facility. It may take us 90 days to get you into the community. Because we have no special get you in cards, okay? We call them up just like you call them up and say, I'd like an appointment to see a dermatologist. We can see you in 6 months. So they're going to have the option to go out, but we're really going to try to keep as many people as we can coming in, okay? The Mission Act is also going to cover some things like urgent care. Specifics of that are just being rolled out. The other thing the federal government does really well, and we did it with the post 9/11 GI Bill, remember? We decided we're going to do it, and within 30 days, we're rolling it out. And we have no idea, not everybody's trained, we don't have good infrastructure set up. It becomes very difficult. So we're going to see this roll out over the next 30 days, so effective 6/6. We now, every provider who wants to provide care to our veterans, with the exception of a few home care, dental, will need to join a network. And right now the network's within Tri-West, and then the network's going to go to a company called Optum. And you'll have to belong. And the reason we did that is the VA can't pay the bills. We're not good payers. And some of my friends back there can tell you. They were getting billed, and I'm sure they were. And some people end up in collections because we're not good bill payers. So going to these networks is going to help make sure our providers in the community are the quality we want in paying the bills. Now, while I'm talking about care in the community, it's important for our young men and women who go to school or work in the community who do not have private insurance to stay connected to the VA. Okay? And you'll ask, why is that? And that is because it makes them eligible under the Millennium Bill. And the Millennium Bill is a bill passed by Congress to bail community hospitals out for caring for our veterans. So any person who has no insurance, who belongs to the VA and comes to the VA, who gets emergently or urgently sent to a community hospital for a car accident, injury, chest pain, whatever it happens to be, are eligible for payment under the Millennium Bill. Okay? They have to stay connected to the VA. And I'm going to say this till I'm blue in the face, because I see young men and women show their appointments, and then they get emergently admitted for an appendectomy because their appendix needs to come out, and guess who owns the bill? They do.
You gotta let the providers know what's going on.
Yep. So they gotta stay connected. Likewise, any older person who has Medicare, who has Medicare as their primary insurance, and gets admitted to a hospital, the VA by federal regulation cannot pay co-pays. So it's important, if you're Medicare age, that you hold on to a supplemental to pay that 20%. Okay? Likewise, if you're a military retired and have TRICARE for life, it's a requirement of TRICARE that you not only have Medicare Part A, but that you purchase Medicare Part B. Because if you do not purchase Medicare Part B, you lose your TRICARE. So it becomes very complex. So people just need to ask the questions. Okay?
You said you have to stay connected. What does that actually mean?
Stay connected means you need to come in and see your primary care provider at least yearly.
And if I have someone, like someone mentioned earlier, we have done a really good job with the Guardian Reserve and the home and getting registered. I'm in a position where I'm seeing some that are coming down from
He can go anywhere. He can do it online, although I guess I'm old. I'm not real trusting of that online system. He should be able to go into the Winstead Clinic and fill out an application. Willamette Clinic, print it off, hand it in, they'll fax it.
Print it off online.
You can print off, it's a 1010 easy. Yeah. But they need,
So when I got that little notice, the tear off that said the Willamette Clinic wants to see me, because it's probably my yearly visit, that's how I stay connected.
correct. Yeah, you want to stay connected. Okay. Any questions on care in the community?
Why are people not automatically, when they're being discharged or joining reserves, signed up? And why is that just not a form that gets filled out and
Because it's too easy. Well, it's not a requirement. People who get out of the military, sometimes they're just very glad to be out. They figure, I've been through combat, I lived that, why do I need to, they're young. They don't really see a need for insurance.
that's automatic insurance that they could get if they're eligible for? That seems something that the government should responsibly do.
Yep.
The military should take care of it.
The DOD, and it's interesting because the Guard and Reserve, when we do these yellow ribbons, some people sit down at my table and say, I'm not going to fill that out. I called over an officer and I said, can you instruct him? He needs to fill this out for me. Because they're still on active duty, so they're not really in control. Their command is.
It's a lot of order.
Yep, and they are told they will sit down and they will fill that out. So we do register all of our Guard and Reserve in our state. Although I have to tell you, the wing and Orange, I have to tell you, many of them, and Granby, have lost eligibility because they were not registered, and we've been to many events at those places, and it's a crime that their command did not facilitate it, and hopefully they're facilitating it moving forward, but it was not facilitated years ago.
I'm seeing one hesitation in getting registered with the VA, with the young population that's getting out. Because in their mind, they think if they're registered with the VA, you're not going to get employment.
That has nothing to do with it.
Right, but I know it's a myth, but to say I have a disability or I have an issue, then they want to go into law enforcement or whatever the case might be. They think there'll be repercussions and they won't get the job.
Right, and nobody can access VA records, except for some of the military can access if they're on a med hold, but nobody else can access VA records.
You put a claim in is a voluntary.
What's that?
Putting a disability claim in is a voluntary activity. You can be.
It's voluntary.
No, I understand it, but I'm trying to encourage them to get, if there's a claim to be put in, go
Right.
see you guys.
Well, the claim versus healthcare are two different places, okay? So they don't need to put a claim in, but they need to register at the VA. Jack, did you have a question?
Yeah, the last week or two of active duty, our military have what's called the CAPS premium, Transitional Assistance Program, and all the players talk to them. VA healthcare, education, Department of Labor, and as you mentioned, they're getting out of active duty, and a lot of times they don't pay attention.
Correct.
In my experience, they know they have a GI Bill, but that's all, even though it's explained to them during that week.
Okay. Anything else? No. Homeless veterans. So we at the VA have kind of done an encompassed of kind of everything, because unlike private insurance companies that may own you for 5 or 10 years, we own our veterans for life. And they're coming in 18 to 20. We've got them now till they die. So we have people for a long time. And we started to realize that people weren't going to do well if they were homeless. So we've worked on our homelessness. We have a homeless team. We have a lot of programs for our homeless. We have emergency housing, okay, which are shelters. And one of the problems is people couch surf, and they don't qualify for homeless services if you have a couch to surf on, okay? In order to be eligible for programs, you need to go through the program. So I said to them, I know you're not crazy about going to a shelter, but this is the process, okay? They go to the shelter, they get them into, and we pay for those shelter beds. We don't want you there any longer than we need you there. We try to get you into transitional housing where they can live up to 2 years, okay? Which are like dorms. There's some shared areas, but they have some personal space. And then we try to either get them to permanent affordable housing or VASH. And our VASH are our Veteran Assisted Supportive Housing, which allows for subsidies. So if a veteran is only 70% service connected and getting like $1,100-$1,200, they only pay 30% of their income for rent.
So, a couple of times I came into contact with a vet that was homeless or in transition. Should I advise them to go to the VA? Like some of them come from other states.
Yep.
They come here.
Yep.
Should I advise them to come to go to the VA to talk about transitional housing?
Yep.
Because I was wondering if I had those resources and I can tell them, go here, go to this place that takes more transitional housing. I should tell them to go to the VA first.
Yep, they should go to the VA, and it's, if you Google it, there's a 1-800 number for housing for homeless veterans. And then we started to partner with the community for beds and housing and programs. And, back in '07 when I started that program, we really thought the government was going to be the big player. Remember? We thought we were going to be the end-all, be-all. And what we've learned is we are not. We are a small piece of the pie, and it's our community partners, our not-for-profits, our organizations like yours that's helping. These are the things that are really going to make the difference and fill the gaps for our veterans. Legal. So, early on, when our men and women came home, we used to say, you've been gone for a year, 18 months, take a break, have 90 days, we'll see you later. Well, we learned very quickly that didn't work, and it really didn't work well in a big way, okay? People were getting multiple DUIs, people were losing their jobs, families were throwing them out, and they'd show up at the VA with their suitcase. It really wasn't working. That was the impetus for the Yellow Ribbon program. We continue to educate both the service member, the family, the community, but we still see people in legal trouble. So the VA has a veteran outreach program, and some of these workers are actually seated in courts, but they help work with the people in the courts to get people treatment. Not that they're not responsible for what they did, because they are. They do have 2 accelerated rehabs, unlike everybody else. They've got an extra one as a veteran. But we really are trying to help them. As speakers before me talked, sometimes people don't realize they're out of control. Sometimes people don't realize their impulsiveness. I keep saying they're adrenaline junkies. They just keep doing these crazy things. They figure they got through combat and they were good, and they're going to try it all now, and yeah, it doesn't work. So that's why the Guard and Reserve has stepped up and really keep track of people 2 weeks after they get home, 30 days after they get home, 60 days after they get home, 90 days after they get home, just to kind of try to keep track of everybody. And they not only depend on the service member's report, they depend on the family member. Service dogs. The VA does not provide service dogs. They come from all of the other organizations that are out there. What we do provide is we provide some care for service dogs for people who are blind, people who have mobility issues. We're in the process, or it's proposed to pay for service dogs for PTSD. Okay? They are allowed to bring their service dog anywhere but inpatient. because there's no one to care for them if they're inpatient, but they can bring it anywhere else in our facility. And they've been very helpful. Some of the people coming out of the military come with their service dogs. Some have, I have one veteran who actually got his service dog who does 82 commands to help him with his PTSD. Pretty impressive training and resources. They're a high expense. You can Google it, you can look at the different organizations that are out there, but the VA does not provide service dogs. Suicide prevention. We heard some statistics this morning about suicide. We have a hotline. They call the hotline, they press 1. All of those calls are forwarded to a local VA that does the follow-up. We have a lot of protocols within our VA for people who call and are suicidal, and I've been detailed over the last couple of months to our care in the community. And one of my schedulers, who's like a GS6 employee, very low-level employee, got a call from a veteran who was making a lot of suicidal gestures. And it's funny because her peer said, sending her a message on her, we have little Skypes, saying, you've been on the phone for a long time with this guy, you need to get him off the phone. What are you doing? And she says, this guy is suicidal. Well, they all just jumped in, got some mental health provider, got the guy to the mental health provider to have him be evaluated because he was verbalizing. And it's a good resource. It's a good resource for everybody. It's a good resource for veterans when they press 1. Especially because we have that follow-up component. We're calling them, if they deem them not suicidal at that moment and they don't send 911 to their door, we're calling the next day saying, okay, we know you called the hotline, what can we help you with? Can we get you an appointment? If they walk into our facility, our mandate is to get them seen, and we will get them seen. We always have some way to do that. My Healthy Vet is our medical record. It's an online portal. You can see your meds, you can see your notes, you can see your labs. Okay, it also has some education in it. You can track, if you're diabetic and you want to track your blood sugars, it'll give you a place to track blood sugars there. It also allows you to send a secure message to your team. And let me tell you, we spend a lot of days running around after these messages because people send it in and say, I need X, Y, and Z. There's a whole triage protocol to get back to that veteran. How do we do it? What do we do to respond to them? Because the newest generation is not liking the telephone. And they email us, and that's how a lot of them communicate. So this is our online portal, which is very nice. These are some of our apps, which are very helpful. One of the ones, some of our pride, and I only put a few here, is Breathe to Relax. And our providers will actually open their phone or pull it up on their computer and do it with the patient right in primary care if they're coming in and they're feeling like things are out of control. So the apps are there. They're very helpful. They're free downloads. Oh, and that's a mistake. I apologize. There's some more apps. Mindfulness Coach, PTSD Coach, the Airborne Hazards and Open Burn Pit Registry. They can use to sign up. We tell people to sign up on the Burn Pit Registry. Again, we don't know the long-term effects, but we're hoping. There's a Coaching into Care for family members trying to help veterans get into care. You can call them. You can go to the website, and they will help the veteran get into care. Let's see. and then make the connection. The PTSD clips you watched are from Make the Connection. It is a site with hundreds of video clips that that have every possible combination. So if you're a Marine, female, sexual assault, you can find somebody on there. And you'll hear their story. And like you did with the young lady who talked about working at the unit and getting into the VA and how it worked. This is our campaign to help people feel connected and feel like they're not the only one. Okay? We are really trying to bring veterans into the VA. Our sheer number of veterans are going to dwindle. As we lose all of our World War II, the number continues to go down. So in order to keep our programs, our funding, our staff, we actively recruit all the time, and hopefully while recruiting we can keep services, because what I think is not going to be good is trying to send more people to the community, because they really don't understand veteran care and they really don't go the extra mile that we do. There's so many things, and we learned there's so many things that happen just within our facility. So somebody who comes to have surgery in the VA, things happen. They just happen. They get their booked up appointment, they get this, they get their equipment, they get all this stuff. When we send them to the community, we're running around figuring out how to do it. Because we're not used to doing it. And there's so many little pieces that we never even really thought about. Just gonna make a plug for my VBA friends here that are our lifeline to help get our veterans the services and compensation that they need. You guys have tables. They are the other half of us and an integral part to our team. And they are the money people. And if you don't have to call that 1-800 number, don't, because it's not the number to call. But Connect will get you connected. We'll help you figure it out. Walk into the 4th floor at Newington, and you will get what you need. Any questions?
One of the biggest issues I know that I run into with new students coming in is we ask them for their immunizations. And they think, oh, I was in the military, they have it all. And again, their immunizations, they don't have measles, mumps, rubella, and varicella from when they were in the service. But they have no idea where those records are. How can the VA help us get them the titer test they need so that we can...
All they need to do is call their primary care team and they will draw the titers.
Thank you.
On the same subject, and the veterans using my health vet, I have a student that went to my health vet because he wanted some of his blood records because of his cholesterol level, and the labs that he had on my health vet wasn't the complete. The cholesterol wasn't even included in it.
Yeah, he probably needs to go back to his provider.
Find out why. Or
Right. Yeah, for what was it missed? It could have been an error, right?
okay, because he went on it with me right next to him, and we went back almost a whole year, 2 years, and every lab test didn't have it.
Didn't happen. Yeah, he needs to ask for it. Look her up. I love that question. Okay. So Jason and I just had that conversation this morning. So any veteran who goes to a community hospital, urgently or emergently, okay, are going to be looked at differently depending on, so we look at each record individually, okay? So if you're a person who has no insurance and is connected to care, you're going to be eligible under the Millennium Bill. So the veteran's responsibility is to call the VA and notify their primary care team that they went. Okay? We document it in your record. We put it in what we call a consult, which allows them to pay the bill. So the veteran needs to tell the hospital, please bill the VA. Okay, please bill the VA. Now, if you're a person who has insurance, okay, and you went to the ER, and it's not for anything that's service connected, the VA is not going to pay the bill. Okay. If you're sick and you call the VA and the VA says it sounds like you need to go to the ER, we are not going to pay that bill. We are like your private physician who, when you call them, do they pay the bill? No. They send you to the ER and your insurance pays the bill. Okay. Now, if you go to the ER and it's for your service connection, or you're 100% permanent in total, we're going to pay it. Okay, but you need to notify us. I have one guy I'm dealing with a bill from 2017. I said, did you tell anybody you went? Well, I don't know. Like, maybe I told the doc. Okay. So now I'm jumping hoops because he's 100% P&T. We really need to pay it, but I got to figure out a mechanism to get it paid. But the hospital bills us directly, and if we pay that hospital bill, we'll pay an ambulance bill or anything else associated with it.
Aaron, vets who had that situation, they tell me there's some kind of like window, a period of 48, 72 hours.
Yeah. They say 48 hours, although I have to be honest with you, I have not seen that in print. And I'm a policy person. As long as they tell us, we apparently have 90 days to pay a bill. So the sooner they can tell us, the better. And if you're the veteran, it's important you tell somebody else in case you can't make that call, so they can make it for you. Anything else? Thank you.
All right.
We talked for a long time.